Now, the Life Esidemeni judgment is set to be handed down this afternoon. At the inquest, Section 27 argued that former Gauteng Health MEC Qedani Mahlangu, the former Director of Mental Health Directorate, that's Dr. Makgabo Manamela, and the owner of Precious Angels NGO, Ethel Ncube, should be charged with culpable homicide for their involvement in the tragedy that cost 144 lives of mental health patients who are relocated from Life Esidemeni. Now, Section 27 represents 44 mental health care users who died in those conditions, and the organization's Tendai Mafuma joins us now for a sense of their own expectations. Tendai, it's lovely to have you on the program. Thanks very much indeed for making time to speak to us. You know, this inquest was essentially established to determine the cause of the deaths. I wonder whether you can take us through what your expectations are, given the fact that we're a few hours now from that order being delivered in court.
Absolutely, and thank you so much for having me on your show, Ayanda. Yes, we've been waiting for the outcome from the inquest for a very long time, so we're anxiously waiting in the next couple of hours. Like you said, Section 27 during the inquest argued that the former MEC, who was MEC Mahlangu, and the former HOD, Dr. Manamela, and also the owner of one of the NGOs called Precious Angels, who was Ethel, we argued that they should be charged with culpable homicide for their role in, the deaths of the mental health care users. So we are hoping that the outcome will align with the arguments that we made. We think it's really important for accountability, for people to be, for such an outcome, and also to give public confidence that when there's been an unnatural death, it will be investigated. And if criminal liability is found, people will be charged and be held accountable.
Absolutely. One almost gets the sense that the NPA is waiting for this judgment themselves before they start acting. But in the event that things perhaps don't go as you envisage, I wonder whether you reckon enough is in the public domain, given the other investigations that have taken place, for the NPA to start acting on people who may very well be responsible for what happened?
Look, so the reason we have this inquest is that the NPA initially was of the opinion that there wasn't enough evidence to charge anyone. So this is why this inquest is really important. And we do hope that there will be the outcome, like I said, we do hope that it will lead to prosecution by the NPA. Even without that, we do hope that the NPA continues to dig into this and gather more evidence so that people can be held accountable. So we do hope that this inquest will not be the end of it, that further steps will be taken to hold people accountable.
You know, one can't help but think of just how avoidable all of this was. I mean, Section 27 was among the organizations that really sounded the alarm before anyone was moved. I mean, at the stage when there were still discussions around the contract with Life Esidemeni being cancelled. I wonder, in your own reflections, given how much time has passed, what comes up when you think about the fact that, as I mentioned, you had tried to warn people that something like this could in fact take place?
Yeah, it is quite tragic, that people did try to intervene right at the beginning to just advise and say, look, you need to make sure that these facilities where you're sending vulnerable mental health care users are actually suitable and that they continue to receive the healthcare services that they need, that they're entitled to in terms of the Constitution. And it's unfortunate that all those warnings and advice were not heeded to, and they continued with this. But I think what has come out of this just also shows the different levels at which people can be held accountable. The health ombudsman investigated and he came up with a report that showed the state of mental health care in Gauteng. And he also made recommendations about what should be improved and what should be done differently. We also had the arbitration, which really looked into resolving the dispute between Gauteng Department of Health and the families of the affected mental health care users. And that in itself was really important to show that when you exercise power and there is a violation of constitutional rights, there will be constitutional damages. So So there've been different, and you know, we also know the SIU has been investigating to see if it can recover some of the monies that were sent to NGOs. So unfortunately, you know, even with the inquest, it's not going to bring back to life the mental health care users who died tragically. But hopefully, going on, we can do better. Hopefully, we can improve services for those who are vulnerable, and we don't turn a blind eye and continue as, you know, yeah.
Absolutely. At the start of this particular story, in other words, when the details were beginning to emerge, you know, we understood the death toll to be around somewhere like 96. And at the time, we were speaking about silent deaths, right? Because we weren't really aware of the scale of what had taken place. And even as we speak today, I can't help but think of the many silent deaths that are ongoing, given the malaise and the level of dysfunctionality that still exists, especially in Gauteng Health. You speak about preventing a repeat of something like this happening, and I wonder how much confidence you have that the health department has turned the tide in ensuring that we don't have unnecessary deaths in any other context.
Look, we continue to work with the Department of Health. We think as an organization, what we stand for is really important, and we think we're really important stakeholders. And there's some, we've made strides to improve the state of mental health care. But I think there are also issues not just in the Department of Health. We've seen in the last month or so reports about how the Department of Social Development has failed to pay some NGOs that also do take care of vulnerable people. And it's really important to keep this lessons that we got from Life Esidemeni to make sure that we're providing the right funding in time to these facilities that provide an invaluable service to our country, taking care of the most vulnerable, and making sure that we support them and they're able to continue the important work that they do.
Yeah, it'd be remiss of us, of course, not to speak about the families, many of them getting an opportunity to only voice their concerns for the first time when that inquiry led by retired Deputy Chief Justice Dikgang Moseneke kicked off. There was a compensation amount that was sent. Of course, that goes nowhere near trying to give consolation to those families. But one can only imagine just their own eagerness as we wait for this order to be delivered later on today.
Yeah, absolutely. These families have really been resilient, and they've pushed for accountability. They've pushed for transparency to understand what exactly happened to their family members. They were at the forefront of trying to intervene when the Department of Health wanted to cancel this contract, and then had to go through the ordeal of some of them searching for their loved ones, not knowing where they had been moved to, and then finding them in horrible states in some mortuaries. So they've really been waiting for this moment, for this judgment to come out, understanding obviously that it's not going to bring them back to life, bring their loved ones back to life, but wanting to see that we are a state that can hold people accountable when there's been wrongdoing, that we don't just move on.
Yeah, absolutely. Even after they resigned, because of course we know there had been a series of resignations over the years for people who are said to be close to the decision-making that led to this tragedy. I suppose we wait with bated breath to see how things unfold, especially given what's at stake. Tendai, thanks very much indeed for your time. We appreciate you all speaking to us. Tendai Mafuma is a senior researcher with Section 27, as I mentioned. They've been involved with sounding the alarm before the tragedy took place and, of course, then representing some of the families of those affected by what ultimately did happen.